What's going on, everybody? It's your boy J Hova, West MG, and we back with a random video Wednesday. So on Wednesdays, we get sent videos and we're gonna react to them live with y'all. I think this video is about depression. So I know I've dealt with it. I know you probably dealt with it. So without further ado, let's get into it, man.
Do you sometimes feel sad or have the blues? This is normal and a part of everyday living. It's also normal to feel depressed after a loved one dies or after a serious illness diagnosis. We may cry, have trouble sleeping, or lose our appetite. But what's not normal is to feel this way for long periods of time. Depression is a mood disorder that affects how you feel and think and how you manage daily activities. Depression can happen at any time in your life. Major depression can affect more than your mood. For example, you might be sleeping a lot or not sleeping enough. You could lose weight or gain weight and generally lose interest in your life. You may even have thoughts about your own death. Sometimes depression happens when a person has other serious conditions like cancer, heart disease, or PTSD. Also, a person may be abusing drugs or alcohol or withdrawing from them and could also be suffering from depression. It's important that veterans seen at VA facilities are screened every year for depression. Depression can be difficult to diagnose, especially when a person has a tough time talking about their feelings. It can be a sensitive topic to bring up with a healthcare provider. However, sometimes a spouse or partner will mention their loved one is having trouble sleeping and is grouchy all the time. With these symptoms, there's often a problem with depression going on too. Some other signs and symptoms of depression may include feeling anxious or having an empty mood that won't go away, feeling hopeless or worthless, losing interest in hobbies or activities you once enjoyed, feeling aches or pains that don't have a clear cause, even after they've been treated. The good news is that depression can be treated successfully, so you can return to feeling more like yourself. If you are a veteran enrolled in VA healthcare and you or your loved one suspects you may have depression,
I don't know if this video is for veterans or not, or what the fuck going on, but we not veterans. We know, we just sad. I'm gonna finish the video.
contact your VA primary care provider, a patient-aligned care team member, or a mental health professional for help. If you are diagnosed with depression, your treatment may include medication and psychotherapy, which is also called cognitive behavior therapy, or a combination of both. Psychotherapy helps by teaching you new ways of thinking and behaving, and changing habits that can add to your depression. People usually do best when they receive both kinds of treatment. Gradually, with proper treatment, you'll start to feel better. During this time, continue to do things you enjoy, but go easy on yourself. Be active and be with other people. Get good rest. Eat at regular times. Ask for help from your family, friends, and your healthcare team. Put off making any major life decisions until you feel better. Remember, don't use alcohol or drugs that are not prescribed to you because they can make your depression worse and harder to treat. If you are concerned about a loved one who is talking about suicide or death, always take them seriously. If they refuse to get help for them anyway. Call the Veterans Crisis Line. It's a confidential, toll.
So, I always kind of hate these type of videos. I'm gonna start out by saying I am not a doctor, bro. I cannot tell you how to deal with clinical depression, or if you having feelings of suicide, call that number. Make sure you please get help. Somebody cares about you and somebody wants you here. I can only speak from my experience, and from my experience, this is how I dealt with some of my depression or the states of depression, because I think most of the time where people feel sad or lonely or feel like nothing's going their way, I think those are just regular feelings like happiness, joy, like excitement. I think people label those things like something is wrong with it. No, all your emotions and all your feelings are telling you something. Something is probably going on in your life and you probably don't recognize it, but something is going on in your life to make you feel this way. You are lacking something. You are missing something. You need something. And people ignore that shit so much and be like, oh yeah, I'm depressed. Like, it's a reason why, bro. You've been drinking every goddamn night. You ain't called your mama. You ain't talked to no family members. You've been out there on every drug in the world, bro. Of course you going to be depressed. The seasons sometimes make me depressed. Like, everybody knows, like, the winter months, I get real irritable for some reason, and I get to, especially coming up on New Year's and Christmas, I get to thinking how much stuff that I gotta do, how much stuff I ain't accomplished yet, how I get to all these plans that I ain't achieved yet, and that shit fucks me up. Like, it fucks me up. I get real distant out of nowhere to everybody, and all I need is like some love and like it's real weird, man. Like, but everybody goes through some sort of it. When they talk about prolonged depression and prolonged feelings of loneliness and sadness, most of the times they be prolonged because we never deal with it. If I'm being honest, we never deal with the problem. We just kind of live in it and hope it goes away. I'm sorry that's not how you deal with anything. Just by hoping it goes away. If you're hoping something goes away, then you leaving it up to chance. So 6 months later, nobody knows that you've been feeling like this because you ain't told nobody. So always, 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 I don't give a fuck if people care or not. Tell somebody. Tell somebody how you feeling. Have somebody you can talk to. Go online. Put the shit on Facebook. Get your feelings out. I don't care if people judge you or whatever it is. Get your feelings out. Somebody cares. Somebody you might not know. You might not have nobody that's you close to, and you might feel like the whole world's against you, because that'd be the thing. People be making themselves look like the victim. And truthfully, nobody just don't know. That's some of the ways that I've seen to dealt with my depression. I got a bunch of ways. I might do another video on this, but this was a dope video, man. I hope y'all like this. I hope somebody out there that's actually going through some depression can reach out to me. I'll talk to you. I'll be bored, man. I'll talk to you. Try to make you feel better. Look, it don't really make me a difference. Yeah, reach out to me. I'll talk to you all day long. Once again, I'm your boy Jay Hova, man. This has been another random video Wednesday, and I hope y'all enjoyed the video. I'm trying to bring out more content this year. Send me some videos to react to, man, and we're gonna get to it. I'm out.